Good morning, everyone. Today, our discussion is about hookworms, and the hookworms which we are going to discuss today are Ancylostoma duodenale and Nectar americanus. So, you can see like the word duodenale, which means like they are or they belong to duodenum, and Nectar means murderer, and americanus it is named like murder or the murderer of Americans is because this one, when it was first defined, it was discovered in America, in some of the states in America, so that's why they name it as Nectar americanus, or like the murderer of Americans. So basically they are hookworms. Okay, so I would like I would write over here hookworms. Now just the introduction about this one, then I'm going to talk about how the parasite looks like. Then we will discuss the life cycle, and then we will discuss the clinical features, then treatment, and then prevention, as how we always go. So, hookworms infection again is a soil transmitted infection which is caused by mostly by Ancylostoma duodenale and Nectar americanus, and that's why we are discussing them together. And it is one of the most important parasitic infections worldwide, ranking second only to malaria in terms of its impact. Okay, so worldwide importance is there, and distribution as well. Okay, now there is an estimated, again, WHO 760 million, that's a lot, people chronically infected worldwide. And when this much is infected, basically they say like around 3 billion are at risk. And most of the people who are living in, you can say, developing areas like African countries, Southeast Asian countries, and tropical regions of Americas, so they are like highly vulnerable. Now, um, this one, Nectar americanus, is the most widespread hookworm infection globally. Whereas you can say Ancylostoma duodenale is more geographically restricted in distribution. So you can say like Nectar americanus is the most widespread hookworm globally. Now, um, the mortality is not high, but this one causes a lot of burden on the children and the maternal health, because the impact of this condition or this infection is basically anemia and malnutrition. And for the baby, especially, when they are growing, they like they can cause a lot of physical and intellectual development problems. So that's why this thing is important. So the humans, they are incidentally infected, and though we are just discussing now Ancylostoma duodenale, but there are many other hook forms like Caninum brasiliensis and others. Okay, so but we'll be discussing this one. So now, like you can say how the mm, condition looks like, or sorry, before we'll discuss like how the organism looks like, right? So like this infection has caused what you can say a lot of burden on the health system. And climate is very important, in transmission of this infection, because any place where the warm weather is there, or there is moisture is there, so these are basically very ideal for the larva to grow. And the area where there is less supply of clean water, there is lack of sanitation, there is poverty, many people they are infected by this thing. And basically, the problem is not this, like this is the thing, but any area where the sanitation is not good, and when there is no clean water, so it is not just like one parasitic infection, rather they have multiple parasitic infections. Like maybe they will be having ascaris lumbricoids and two, three, four parasites together. So you can say that that's the important thing, and whenever like we treat them, we try to treat them with multiple or against multiple parasitic infections in these areas. So you can see a map, by the way. I will see like if we can find any map on Bing, so I can show you the map, worldwide, or sorry, distribution of hookworm infections. So maybe we found like so see, like there is multiple photographs, talking about like the distribution of the hookworm infection, right? This is like a nice one, you can say. Um, you can see like this one. What are the areas which are infected, right? So as I told you, like I have some problem with the computer, but like you can see over here, right? This is like this one shows exactly how it looks like. And most of these, they are the children, and you can say like here basically they're talking about the age group as well, but we can like it's hard to see from here. Okay, this one is like about, but there are like um, about the age group as well. There are some charts about the age group as well. So now, like this infection is like so much widely distributed that worldwide, in many of the countries you can see over here, how many countries are red. Like even China is in red, all Africa is red, like except the northern Africa, and see the central as well as Latin America and India, Pakistan. Arab countries do have, but like their color is not like that much red. Even Australia is the one which is infected. So very, 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 you can say a huge burden of the disease. Uh, there are many studies they conducted in Africa, in Asia, and what they found is like between one third and one half of moderate to severe anemia among pregnant women can be due to this hookworm infection. Like so common, guys. Okay, so this is how the infection looks like, by the way. And after that, like I want to show you how the organism look like. So this one is like Ancylostoma duodenale. You can see the male one and you can see the female one, and uh, you can see like how they look like, right? Like they have the esophagus, right? They have the buccal capsule, copulatory spicules in males, and vulval opening in females. There is anal pore, and this is the copulatory bursa by which they copulate to reproduce. The male are smaller, the female are larger. Male have this copulatory bursa, female don't have that. whereas you can say posterior end is tapering in the female and expanded like an umbrella because of this copulatory bursa in males. This is how they look like, right? And these are the eggs, how the eggs look like seen under the microscope, and this one is a diagram they have done. They are basically colorless and they float in a saturated salt solution, and you can see like the eggs contain these blastomeres. 4 to 8 blastomeres are there. A single female worm lays around 25,000 to 30,000 eggs in a day. So they lay around 18 to 54 million eggs during their lifetime. So quite, you can say, extensive type of thing, right? Now, guys, talking about the infection, you can see again, this is the infective stage and this is the diagnostic phase. And the hookworm transmission occurs when a third stage filariform, this is filariform larva, come in contact with the skin. And this larva basically have the ability to penetrate the skin, and most often like those of the hands and the feet, arms and legs, or simply the exposed area. So basically they enter through the hair follicles, or if there is any break in the skin. So following skin penetration, the larva enters the subcutaneous venules, like the same thing which we are discussing for the last 2-3 weeks. And then through the lymphatics, it goes into the circulation, reach to the right heart, reach to the reach to the lung circulation or pulmonary circulation. And ultimately they will reach to the pulmonary capillaries, they will penetrate the alveoli, then they are sent to the bronchial tree, from bronchial tree to the trachea, and then they go into the epiglottis, into the pharynx, and then they are swallowed back into the GIT. So once in the GIT, the larvae undergo 2 changes in the lumen of the intestines before they develop into the egg-laying adults, adults form around 5 to 9 weeks after skin penetration, or you can say around 1 to 2 months after they will reach the adult form. So they are around 1 centimeter in length, but as you know, the females are larger and the males are smaller, as I show you, right? So simply the adult hookworm, or I'm talking about both, like either it's Nectar americanus or Ancylostoma duodenale, they live in the proximal portion of the small intestine, or you can say the duodenum and jejunum, right? And here they can live for years. Okay, they can live for years, a long time. So the thing over here is, Ancylostoma duodenale, it survived for an average of 1 year in human intestine, whereas Nectar americanus, they generally live for 3 to 5 years. So you can say this one around 1 year, this one around 3 to 5 years. So this adult one, they keep on attached onto the mucosa of the small intestine, okay, and after that, they, you can say, uh, they take on their nutrition by sucking the blood, and they keep on sucking the blood, and that's why they like the patients, they have anemia. So what they have in them is hemoglobinases, for the enzymes which can basically digest the hemoglobin. So that's why they keep on consuming the hemoglobin from the humans host. Okay, and this is the primary thing they consume for their uh, for their diet. Okay, they keep on consuming the hemoglobin. So humans are basically considered as the definitive host, and there is no immediate or reservoir host. Now, what happened? The females, they keep on producing eggs, and as I told you, how much eggs they can lay, like it's enormous. It's too much. Ancylostoma, basically, they lay more eggs than Nectar americanus. This one around 28,000. This one around 10,000 per day. So what happened whenever they lay eggs, and the like eggs pass in the feces, so it reaches the soil, and in the soil it gives rise to rapidity form larvae. Of course, like under the ideal condition of moist soil or warm weather is there, right? So they keep on feeding, taking their feed from the organic material in the soil, and after about 7 days, the larvae stop feeding and they keep the change, and they develop into the third stage, infective flariform larva. So basically, they are present on the grass, and whenever they come in contact with the human skin, okay, they can enter the human. So this larva outside the human body can survive up to approximately 2 weeks, and that's the reason. So guys, quite easy. Enter the skin again, like circulation, right heart, lungs, GIT, start producing eggs. Remember, this one consume hemoglobin. It have hemoglobinases. So this is about the life cycle and what is the clinical manifestations or the clinical features of this condition. Now, if we'll talk about the clinical features of this one, the clinical features can be separated into acute features or acute manifestations. Uh, okay. Um, of course, like acute manifestation means what? Like, it will enter the skin, it will reach the lungs, it will reach the GIT, that's it. Like, which is the same story as the previous one. Nothing different, okay? So, simply. And also chronic manifestations. Now, chronic manifestation, they result from the parasite in the intestine and they keep on consuming the hemoglobin. So, again, guys, like as in the previous lecture of strongyloids, uh, I told you uh, the important thing, right? How they have cutaneous manifestations, pulmonary manifestations, and GIT manifestations. So you can say they have almost the same manifestations without any much difference. Okay, so like if you want to understand like what I'm saying, you can see my previous lecture in detail. So of course, like you can say what you can say, like anyone whenever they get infected by this larva, this one, they have skin manifestation. We call it as ground itch. And what is ground itch? It's itching, a local pruritic um, erythematous and papular rash. Okay, and it's commonly present on the hand or feet. So this thing uh, will be there, right? Now, what happens is um, like whenever this thing occurs, of course, like if the area is highly endemic or there is too much infections, you can think of this thing. But many of the times, like we can see some skin changes as well, like as the larva is migrating under the skin. Okay, as the larva is migrating under the skin, so we can see the tract of that larva. We call it as creeping eruption. We call it as creeping eruption. So creeping eruption, like maybe I can show you here on Bing and creeping eruption. You can see, like, see, it looks like this. See, because the larva is moving under the skin. You can see over here or over here, right? Very, see, like the larva is moving under the hair, under the skin in the subcutaneous region. So we call it as creeping eruption. See, a lot of larvas, right? We call it as what? Creeping eruption. So this creeping eruption can be seen, right? So these tracts or these eruptions, they can be elongated every day, and sometimes it can be there for years. Okay, but when as soon as the larva will like leave that area, like these eruptions will be healed. You can say within some weeks. So you can say like after around 1 to 2 weeks of this skin infection, uh, you can say there will be lungs manifestation. Okay, you can say like this way that after around um, um, 1 to 2 weeks, the um, larva reaches larva reaches the lungs, right? So the larva reaches the lungs, and again, like in this one, if you remember the lung manifestation, you can talk about that, right? Like simply, cough will be there, wheezing will be there, wheezing can be there, cough, dry cough, or these things can be there, right? So now, um, of course, like when the larva is ascending through the trachea, and then it will reach to the pharynx, and then it will be digested by the or taken up by the GIT. So this thing is important. So now, when we ingest that, um, like there could be acute symptomatic disease after ingestion. So what is this thing? Like the patient, they present with nausea, vomiting, hoarseness, and dyspnea. In some of the countries, it is called as Wakana syndrome. Okay, not important to remember, but like in some of the areas, this is called as Wakana syndrome. So simply like what it is ingested, if it will be reached the GIT or the intestines, in simple words, then the manifestation will be changed. Then it will be like nausea, vomiting, abdominal pains, bloating, all this stuff. Okay. So now, like they will keep on laying down the eggs. Okay, and uh, like the patient will have like either these symptoms which can go unnoticed simply. Sometime some of the patient, they have like acute enteritis with uncontrollable diarrhea and foul stools or very bad smelling stools. But like it can there can be no symptoms as well, right? Now the person will reach or go into the chronic status or chronic infection. Now the chronic disease is simply, guys, it is due to anemia. Okay, they keep on um, consuming your hemoglobin. Okay, and they stay in the small intestine and they keep on consuming the hemoglobin. Okay, and what will happen, like once they will keep on consuming the hemoglobin, it is estimated like around 0.1 ml of the blood is lost every day, okay, which is like too much, sometimes up to zero point 0.3, by the way. So what will happen chronically is basically they have anemia. What kind of anemia? Simply iron deficiency anemia, right? They present with iron deficiency anemia. So this will be the one of the manifestation. Now, what will happen, because it's not like the anemia which will be there, but of course, like a lot of proteins will be wasted as well. So people who have heavy hookworm infection, they may go into hypoproteinemia. Okay, and these are the two things, by the way, which basically cause too much burden on the children or developing children and the maternal pregnant females. And this is what you can say the main things by which most of the babies, they are physically and intellectually not developing normal, okay, in many of the countries. So that's why they are worried of this thing. Now, guys, if you know what are the features of anemia as well as what are the features of hyperproteinemia, I think like the rest of the story is clear. For example, anemia features are dizziness, weakness, pallor, tachycardia, fainting, dyspnea, palpitations, things like this, right? And what you can say, like, and hyperproteinemia, of course, they may have develop edema, for example. Okay, so these are the things which can be there, and of course, like not just these things. Of course, like these patients, they may have diarrhea and constipation as well. But these are the chronic manifestation of this condition. Okay, so this is how this thing present, right? Now, so okay, this one is too creeping eruption is too you can say specific for this condition, right? And the diagnosis can be made at this stage, or the thing you will start thinking about this stage. Okay, so how we diagnose this condition now? Diagnosis. So now the diagnosis, again, the first of the things will be stool microscopy, which is of course like from that CDC chart you can see, like we can see the eggs in the stools. So what happened, like in the infected adults or in the affected humans, a single female, it produced thousands and thousands of eggs. So that's why when they produce thousands of eggs, it can be easily found. Contrary to the previous lecture in which like they produce less eggs, they produce good amount of eggs. So as I told you, the eggs are colorless, and they are quite small, but they are colorless, and there are special techniques by which they can see the eggs. For example, they can use formalin, ethyl acetate sedimentation method, and some things are called as concentration procedures, in which like they can dry up the mount, and then they can use some stainings, okay, to see the eggs like under the microscope. So this thing can be done. So uh, now, other than microscopy of the stools, CBC can be done, in which like there will be eosinophilia, and it is a common finding. We can see. Now, chest X-ray can be done, of course, to check for the lungs when the pulmonary phase is there, or sputum examination can be done if like it is the time when it is migrating. You can get this thing, right. You can get the test positive. These things, and there are, what you can say, um, other diagnostic methods are also there, like other than microscopy or stool culture. Um, so see, like the diagnosis can be clinical based on the this cutaneous eruption. We also call it as cutaneous larva migrans. So like the larva is migrating. Simply remember from this thing. So there could be like the skin groundage. There could be like this cutaneous. Sorry, this there could be this one, or there could be like lung manifestation. And whenever it comes to the diagnostics, we can go for stool microscopy. Okay, uh, we can do for CBC, we can go for chest X-ray, we can go for sputum examination. And CBC will show what? CBC will show high level of eosinophils as well as microcytic hypochromic anemia. So these things can be done, right? So stool culture is one of them as well. Sorry, I wanted to write over stool culture can be done as well. So these are the way of diagnostics of this condition and how we treat it. Treatment. Now again, the treatment goal is to eliminate the worm completely from the GID. That's an important thing. Okay. And the most common drugs which are used again is benzimidazole group. For example, mebendazole, albendazole. Okay, all these drugs can be given. So, like these both are, by the way, broad spectrum antihelminthic agents, and a single dose of mebendazole or albendazole, single dose or multiple doses, both are enough, by the way. So this is what you can say is the treatment of this condition, and simply we give them any stage, like even if you will found the patients, at any stage, you can give these drugs. And one of the drugs which I'll talk about in the previous lecture as well, ivermectin. So when you will study pharmacology, you will study about ivermectin as well. We can use that as well. So this thing, and the other treatment is of course treatment of chronic stages, of course, like treat anemia and treat malnourishment. Okay, and of course, like how we treat anemia, how we treat malnourishment, that's a different discussion completely. So the last thing, guys, which we are going to discuss in this one is the prevention. Okay, prevention, like as we always discuss. So again, like the first thing I will say, like improve sanitation. Okay, that is the most important thing. Okay, in this one, proper, you can say, personal protective equipment for people at high risk. Like footwear, we should be there, gloves should be there. Okay, all these things should be there. So of course, like this one, because many of the people, who work like in agriculture field, it's very hard for them. So of course, like they must use proper PPE or personal protective equipment, because this one they can penetrate the skin. So of course, that's an important thing. And many of the people, they use the feces as a fertilizer as well. So this thing, one thing is like treat the infections, give them drugs. Of course, in many of the countries they used to give albendazole or mebendazole to the school children, and just to decrease or. By the way, one of the thing, in our country, whenever the patients or the babies they come to the pediatrics with the anemia, so they are usually given albendazole just to deworm them. Okay, so that's the important thing. So because like they cause like serious problems in the children, especially because their growth is affected, their development is affected when they have this infection. Now you can say other things which we can do is other than this is like of course, like awareness of the condition. You can say awareness can be spread in the areas where this is endemic. Of course, like the people should be educated what to do if they found this features, the signs and symptoms. They must go to the doctor. One of the thing, like education is very important in this case. For example, not just the people, but also the healthcare workers to deworm whenever like anyone is presented with anemia, for example. So deworm them, of course, that is going to help a lot. So that's all about, guys, about this Ancylostoma duodenale and Nectar americanus, which are both hookworms and they cause such a condition. Thank you so much for listening. I will see you next week.